Local woman Hannah Perry was 38 and early in her second pregnancy when worsening digestive and bowel symptoms signaled to her something wasn't quite right.
Yeah, and this week's Healthier Together, find out how she's learning and how she learned that she was amongst the rising numbers of younger people with colon cancer.
Hi, my name is Hannah Perry. I am a stay-at-home mom of 2 boys, 5 years old and 3 years old. I've been married for 7 years to my husband, Craig, and I am a cancer survivor.
I got a call that day from our gastroenterology that he just performed a colonoscopy and found a colon mass. And he mentioned to me that she is pregnant.
The first warning signs were probably the June prior to the diagnosis. I just was having trouble with a normal bowel movement, but I also was chasing around a 1-year-old at the time, and I was newly pregnant. And so really the only reason that I decided to make a phone call was because I couldn't imagine myself doing that every day with an infant on my lap and a 1-year-old. It was so uncomfortable.
I always joke with my patients. I tell them all of us have to poop. So we really need to talk about that.
It was hard. What are we going to do? Am I going to die? You know, or do I have to have a colostomy bag? Life changed pretty quickly. Dr. Rashidi came in and she pulls her chair up and she sits right here and she's got her hands on my knees and she's looking at me like a person in my eyes and telling me what is going to happen, what can happen, what the possibilities are. And she built a trust in me right then that I will forever be comfortable going in to a medical situation, believing that there are people out there like Dr. Rashidi that can make someone like me be comfortable. Her bravery to tell me the truth, that it might not be okay, it's just admirable. And my husband as well, on the way home, I told her I wasn't going to do it at first. I said, nope, we're going to wait and we're going to have the baby and then I'll take care of me. That's moms, right? Kids first, moms last. He talked to me on the way home and he said, who do you want to tell Wyatt the story? Do you want to be able to tell him, or do you want me to have to tell him? And that just hit home for me, you know. We have a strong faith in God, and he guided us through that whole entire process.
As a surgeon, when someone comes to my office, once they get to that room, we are a team. Both surgeries were done robotically, which actually a laparoscopic or robotic approach is very difficult in pregnancy, but we were able to do her surgery robotically with a small incision.
It took a lot of effort on my part to be able to find the right people that were not necessarily the right people for my case, but the right people for me. Because if anybody goes into a situation scared, anxious, fearful, it's not good for any party. And when you find somebody that's on your team, it works. From start to finish, it was a year, which really, it's a year of your life. That's it. It's a blip. Now I have the rest of my life.
Cancer is out there, so make sure to pay attention to your body and your symptoms. And if you notice anything that is not right for you, discuss that with your primary care physician. Colonoscopy is very, very important for screening and diagnosis and can be preventative, so don't be afraid of it. It's very important to do your screening, and if you're younger than age 45 and you're having symptoms, take it seriously.
And a reminder, you can find all of our Healthier Together reporting on fox13seattle.com.